Dr. Nancy here, your MPJE Whisperer. As an ex-pharmacy director and also director of clinical operations with over 17 licenses, I am your plug to acing your MPJE with the first take, right? Last week, we talked about preparatory steps that you have to take in order to successfully study and pass these exams. This week, we're going to talk about or delve into one of the competencies, right? You tend to, as you study, try to retain everything. And in doing that, you're shooting yourself in the foot, right? The best thing is to think, what do I need to practice independently as a pharmacist, right? And then what skills do I need to troubleshoot? That's really what preparing for MPJE is all about. The laws, the rules, and regulations that govern the practice of pharmacy. So you've downloaded the PDF of the laws and regulations from the pharmacy, State Board of Pharmacy website. You have prepared a study plan, right? You have to have a plan. And you've broken down the study material into maybe hours of days that you dedicate to studying, or chapters that you read daily, right? We're going to assume that you're going to study for this and prepare for this in 4 weeks. 4 weeks is more than enough. Like I said, I've done 2 weeks, I've done days, right? So we get into first, licensure and personnel, right? You think about who works in the pharmacy, what should I retain about that information? And because I can't store everything in my head, I shall be talking through some material that I prepare for clients that I consult with when they're preparing for their MPJE. So the first thing to think about is who's in the pharmacy? Pharmacist, pharmacy intern, pharmacy technician, sometimes a pharmacy aide, right? Which ones do your state have? Who is required to register at the State Board of Pharmacy, right? And then we ask ourselves, what is the state requirement to becoming a pharmacist, right? These are things that you should make a note of as you read in your review sheet. What are the criteria for reciprocation? That's something you should know. What are the requirements to become a pharmacy technician, right? A graduate intern, a pharmacy technician trainee, if that state has it. Now, there are then different continuing education requirements for each person, right, that's practicing the pharmacy. And what is that, right? How many CE does a pharmacist need per renewal period? And you ask this question for every person that's working in the pharmacy, right? And then, are there any special requirements when it comes to these CEs? Meaning, an immunizing pharmacist, is there a special requirement there? A collaborative pharmacist, what are the requirements there, right? Are there any, states like Michigan may have human trafficking requirements, right? There may be some adverse drug events requirements that you need to know. So these are things that you should pay attention to, and these are things that can show up as questions, right? And then, should these CEs be accredited? And who is the accrediting body? Very important to know. Now, another thing is, you should know the relationship between continuing education units, right, and continuing education contact hours. Something you should know. Now, the establishment that you practice in, right, how often do you need to renew that, right? And how often do you need to renew the licenses of individuals who work in a pharmacy? Very important to know. Some states have specific dates for pharmacists, right? And then for interns, and then for technicians. So if that state that you're studying for has those things, very important to know, right? And then, when is a permit void? Sometimes there is a grace period. So your license expires, let's say June 30th, right? But you have until July 30th, July 15th, depending on what the state says, before it becomes null and void. Meaning, if you renew after it's expired, you have that window, you're going to pay a late fee, right? But your license is not void. You don't have to reapply and do any other extra thing. You just renew and pay the late fee. But after a certain period of time, which the state will specify, if you do not renew, then that license is void. Shouldn't be doing anything at all with it, right? And then, standards of practice. Who can offer patient counseling? Right? That's a very important question to answer. who can perform patient counseling. These are two different things, right? When we used to work in the alphabet pharmacies, like we say, I used to manage one for a long time. When people come to pick up their prescriptions, right? Depending on the state that you're in, the person checking out the prescriptions can say, do you have any questions for the pharmacy? And they have it on their screen to ask that question, right? And the patient will say yes or no, and then they can click either yes or no, right? But important to know, when is the patient counseling required? You need to have that in your review sheet. What documentation is required, right? That you should write down. Who can make this documentation? So if you offer counseling and the patient says no, are you required to enter it in any system beyond the cashier's register in the patient's profile, right? These are questions you must answer because each state may have a little bit different requirements. And then who can make the documentation? Sometimes we assume the pharmacist, right? But there are some states where the intern can. So very important to pay attention to the state law for the state that you're studying for. Now, who can offer OTC counseling? When people show up at the counseling station or anywhere and ask about medications, who can actually step to them? Can someone else besides the pharmacist step to them and counsel? That's how you should think about it, because for sure a pharmacist can, right? But then the question as you're studying is who else can? And it's a yes is, the question you ask yourself is, can anyone else besides the pharmacist offer counseling? If that is a yes, then does the pharmacist have to be present, right? Do they have to be standing beside them? Or do they leave that person to independently answer the question? These are things to remember. And then, what is a prospective drug review versus a retrospective drug review? This showed up a lot. And then who can perform them, right? Who can perform them? When are they performed? When do you do a prospective versus a retrospective drug review? Then the next thing that we look at as we continue reading is a patient comes to you and they ask for a copy of their prescription. What do you do? Right? What do you do? You play that scenario in terms of a prescription that's not controlled, and then play that scenario in a prescription that's controlled. Is there any difference? Right? You should know this going to take your exam. What are the difference between pre-packing or pre-packaging and repackaging? Very important to know. And then what is the definition for something that's misbranded, something that's adulterated, and a counterfeit drug, right? These are things that in your day-to-day practice, you look out for, right? And so it's very important that you know the definitions because they do show up all the time. Because believe it or not, with all our regulations, drugs that are misbranded, drugs that are counterfeit are still in circulation. So we got to be cognizant of what those things mean, those definitions, and so we know what we're looking out for. All right, so we know a few things in our day-to-day. Let's go a little bit deeper in our pharmacist, intern, technician scope of practice, right? You're looking at licensure and personnel. So what can each person do holistically? You should leave your study room or your study hour when you're focusing on licensure and personnel with many of these answered on your review sheet, right? The reason why I'm not giving an example is because it differs per state. So I'd rather you have the question and answer it than give you an example and somehow it sticks to your head and it's not even for the state you're studying for, right? If you feel like you follow better if I give examples, then let me know if that's not going to be confusing, right? For those who are reciprocating, I always feel like it's a little bit easier because you have in your head what you can do in the state that you're in. And it's now a question of asking yourself, the state that I'm going to, is it the same? Meaning, let's say pharmacy license expires every 3 years in the state that you're in. Is it the same in the state that you're going to? Some states are annually, right? Some states are every 2 years. So you have something, a baseline to compare and contrast, and sometimes that helps you retain better because you just know, it's opposite of what I do, or it's really what I do, right? Okay, so let's go forward. What is the scope of a